Good morning, everyone. My name is Adélia Lúcio. I'm a PhD physiotherapist, and I'm gonna talk about historical milestone in general overview in women's health policy. In this class, we're gonna talk about women's health condition and what determines and conditions this situation in Brazil. We are going to increase our political awareness of health and know the social determinants of health conditions. First of all, it's important to know that in Brazil, the right of health is a great Brazilian achievement that took years of popular movements and negotiations. And in 1988, proudly, health became everyone's right and state duty through a system called Health Unique System, with the initial SUS in Portuguese. Since then, public politics involving women's health have been created. Women are the majority of Brazilian populations with 51.70% and the main users of SUS for themselves and also as a companions of children and other family members. Therefore, they contribute a lot for the consolidation of SUS. Health condition involves several aspects of life, such as relationship with the environment, leisure, feeding, and conditions of work, housing, and income. As Brazilian society is unequal, health and disease are also unequally distributed among gender, race, and social status. Whether because of different social status or and vulnerability, or because of inequality in access to health actions and services and quality of life. Women live longer than men, but they get sick more frequently. Female vulnerability related to certain diseases and reasons of death is more related to the situation of discrimination in the society than with biological factors. In order to understand the factors that affect the health pattern of Brazilian women, the Ministry of Health has been regularly preparing documents for the knowledge and epidemiological data in order to outline strategies for women's health care and propose guidelines for the humanization and quality of care issues still pending in women's health care. Most literature on women's health, in most literatures of women's health, the woman's body is seen only on its reproductive function, and motherhood becomes its main attribute. Women's health is limited to maternal health and or absence of illness associated with the process of biological reproduction. So issues about sexual rights and gender are excluded. In 1994, at the International Conference of Population and Development, reproductive health was defined as a complete state of physical, mental, and social well-being, and all issues concerning the reproductive system, its functions and process, are not just the absence of disease or illness. Reproductive health therefore implies that the person can have a safe and satisfactory sex life, having the ability to reproduce and the freedom to decide when and how often to do so. Although this definition is based on the World Health Organization concept of health and incorporates dimensions of sexuality and human reproduction from a rights perspective, this concept is restricted to reproductive health and does not treat health disease as a process from the perspective of social epidemiology, which has been widely discussed since the late of the 60s. Health and disease are closely related and constitute a process whose outcome is determined by the action of social, economic, cultural, and historical factors. This implying stating that the profile of health and disease varies over time and space, according to the degree of economic, social, and human development in each region. According to health indicators, population exposed to precarious living conditions are more vulnerable and live less. The 2002 World Population Status Report shows that more women live in poverty than men, that women work long hours than men, and that at least half of their time is spent on unpaid activities, which reduces their access to social goods, including health services. Considering that the historical inequalities of power between men and women have a strong impact on the health conditions of the latter, gender issues should be considered as one of the determinants of health and in the formulation of public policies. Gender. Gender refers to the set of relationships, attributes, roles, beliefs, and attitudes that define what it means to be a man or a woman. In most societies, gender relations are unequal. Gender inequalities tend to deepen other social inequalities and discrimination based on class, race, age, sexual orientation, ethnicity, disability, language, or religion, among others. Women and men, due to social organization of gender relations, are also exposed to different patterns of suffering, illness, and death. Based on this, it's essential to incorporate a gender perspective in the analysis of the epidemiological profile and in the planning of health actions, which aim to promote the improvement of living conditions, equality, and women's citizenship's right. Fertility transitions is a phenomenon that involves several factors. The process of urbanization and industrialization enabled an advance in education, income, and female autonomy. In addition, the reduction of infant mortality increased the number of surviving children, and families began to reach the ideal number of children earlier. That's why the birth rate has been falling. This graph shows the intense urbanization and process that the country has gone through. In the 40s, it was a population of 41 million inhabitants, where um, where 28 million lived in rural areas and 13 million in urban areas. In the 20s, out of the 170 million Brazilians, 138 million lived in urban areas and 32 millions in rural areas. With this intense migratory process and rural exodus, there was an impact on social indicators and on the population of health, disease, and their representations. This graph shows the evolution of the increasing life expectancy over time. Women live longer than men, but in the 90s, the life expectancy was 65 years old for women and 59 for men. And in 2005, this life expectancy increased to 75.8 years for women and 68.1 years for men. Between the 80s and 2007, the number of Brazilians over 60 years old grew from 7 to 17 million. Despite population aging, 46% of the population is under 24 years of age. 66% of Brazilian population is of working age. The number of children per woman has been declining sharply. In 2004, women started to have an average of 2 children and trying to keep declining. So the difference between the 40s and 2004, 2004. There was a change in the profile of causes of mortality. In 1930, Violence was the cause of 3% of deaths. Uh, so 3% of deaths. Neoplasm, for 3%, also for 3%. Disease of circulatory systems, for 12%, and infectious and parasitory disease for about 50% of the deaths. In 2003, violence was the cause of 13% of deaths, neoplasm of 16%, and disease of circulatory system for 28%. This one, this one. And infection and parasitic disease dropped to 5%. The more natural the birth, the better the child's birth. What women have always known by intuition, science has been showing. In the movement known as evidence-based medicine, interventions such as episiotomy, C-section, when not necessary, can be more harmful than good. The World Health Organization recommends C-section rate to be close to 15%. Larger or much smaller values are harmful for mothers and babies. In Brazil, the C-section rate in 2005 was almost 3 times higher than recommended. It reaches 43%. Humanized childbirth is the expression used for births in which the woman is respected. She stays with the companion of her choice. She can move at her will, drink liquids or light foods, choose the position to give birth to her child, concentrates to push according to the rhythm of her body. The humanized childbirth, the woman is spared from unnecessary interventions such as oxytocin, intestinal washing, shaving the pubic hair, episiotomy, or fasting. In humanized childbirth, the woman does not lay down all the time. She receives words of encouragement, and no one tries to belittle her for having a child. Labor is considered a noble work. The natural birth centers are placed similar to women's homes with different environment from the hospital, but with all the necessary equipment and trained professionals to support natural births. In these centers, women can have their children naturally with escorts of her choice and personalized service. When women who have their children in natural birth centers report more satisfaction with the birth experience. The Ministry of Health supports the construction of equipment for natural birth center in several states. Doula is a word that comes from the ancient Greek that means the one who is beside. Generally, it's a woman who has good experience in childbirth and helps others, supporting them to teaching them to help and teaching them to help themselves. So sharing my experience with a doula, I had a natural birth of my daughter was born in a natural birth, in a humanized birth. In my opinion, the presence of the doula was so important as the presence of the physician. For a woman, the presence of a doula is very important, and I do recommend. Personally, I do recommend. With the encouragement she receives from the doula, the woman feels more secure and confident to let her daughter or son to be born. The Ministry of Health has already financed training for voluntary community doulas in 12 states and the federal district. And furthermore, scientific studies show that just by having a company of her choice, women have a shorter labor, require less anesthesia, and delivery progress so well that cesarean sections end up being less frequent. Between 20s and 2008, For the average number of children of teenage mothers decreased by 19%. Although this is still worrying, in 2004, around 3 million children were born in Brazil, of which 26,000 were from mothers between 10 and 14 years old. In the same year, 7 out of every 100 teenagers between 15 and 19 years of age became mothers. In all Brazilian regions, the cesarean rate is above that recommended by the World Health Organization, with higher prevalence in the southern region of the country. About prenatal. Among white women, only 1% did not receive prenatal care in 2005. Among black women, 5% did not do so. And among browns, 3%, almost 4%. Among women who had 7 or more consultations, 67% were white, 45% were black, 46 yellow, and 39 brown. Fewer prenatal consultations, however, were performed by indigenous women. 12% of them did not receive any prenatal care, and only 23% had 7 or more consultations. It is possible that the increase in births of premature babies is associated with the increase in the number of unnecessary cesarean deliveries performed before their time. A population-based study that started more than 25 years ago in the city of Pelotas, Rio Grande do Sul, observed that in 1982, the rate of cesarean sections was 28%, and that of children born prematurely was 6%. In 2004, the cesarean rate rose to 43%, and the prematurely reached 16%. In the same study, a clear association between poverty and teenage pregnancy was observed. Teenage pregnancy is more frequent in teenagers from families that earn less than one minimum wage, than in teenagers from families that receive more than 10 minimum wages. Cesarean section is a great life-saving surgery when there is risk for the mother or baby. Every surgery has its risks. A cesarean too. Reaction to anesthesia, accidental cutting, more bleeding, more infections. Thus, an unnecessary cesarean can bring a lot of problems for the mother and the baby. Cesarean section is higher among women with higher education. Most episiotomies are performed unnecessarily because the woman's body is able to open up to allow the baby to pass through. The World Health Organization recommends that childbirth be as natural as possible, respecting the nature of women. In 2006, more than 2 million women aged 10 to 49 were admitted to SUS hospitals. Of these, 233,000 due to abortion and 120,000 due to violent causes. In 2005, 63,000 women aged 10 to 49 years died in Brazil. Of these, 1,619 for problems related to pregnancy, childbirth, puerperium, and abortion. There were almost all, these are almost all preventable deaths. Death from the breast cancer, which has had been increasing at the turn of the millennium, has been increasing, stabilized. The reason for the stabilization was due to the increased access to tests for early detection. This shows how fundamental prevention is. Even so, in 2005, more than 10,000 women died from breast cancer and 4,000 from cervical cancer. So this type of cancer is still the most common among women. The breast cancer is still the most common. This graph shows that mammograms are directly related to the length of study in years. The women who had more mammograms in Brazil had 15 or more years of schooling. It is estimated that there are around 75 maternal deaths, it's around, so in average, of women from causes related to pregnancy, childbirth. I'm sorry, 75 maternal deaths from every 100,000 live births in Brazil. So every 100,000 live births, 75 women die. Problems related to high blood pressure were the most responsible for maternal deaths, and Black women were the biggest victims. This graph shows the number of maternal deaths according race. In 2005, there were more maternal deaths in Black women in general than in white. Abortion is a public health problem of great magnitude. 686 women are hospitalized by SUS each day due to complications related to abortion. 250, more than 250 women were hospitalized in 2006, representing more than 4 abortions for every 1,000 women of childbearing age. Abortions contribute to 15% of maternal mortality. A recent survey by the Institute of Social Medicine of the State University of Rio de Janeiro estimates that there were about 1 million abortions in Brazil in 2005. The Committee of United Nations Organization for the Elimination of Discrimination Against Women shows that the classification of abortion as a crime does not reduce its incidence. On the contrary, this has contributed to increasing the practice in situations of risk with serious impacts on women's health and lives. The practice of unsafe abortion shows socioeconomic, cultural, ethnic, racial, and regional differences. Women with more economic resource perform abortions with greater safety, with better hygienic conditions. The prevalence of deaths due to abortion is higher in white and brown women than in Black men. In 1985, there were 15 new HIV cases for men for each woman. In 2005, there were 10 women for every 15 men with HIV. The epidemic becomes more feminine, expressing the greater vulnerability to which women are exposed. It is also important to note the change of epidemic status. It has been moved from human centers to the countryside of Brazil, from the south to the southeast, to the north to the northeast, from the youngest to the oldest, from whites to blacks, from the most rich to the poorest, from homos to heterosexuals. It's important to note the significant decrease in cases among sex workers and injecting drug users as a result of prevention and harm reduction policies, such as needle exchange for injecting drug users. This is in the participation and mobilization of users in civil society have been decisive for this confrontation. These victories are not only the drop in mortality in the number of new cases in the country, but also the improvement in the quality of life of those living with HIV, the reduction of prejudice, the increase in awareness of prevention care and solidarity. There are many forms of violence against women. Intrafamiliar or domestic violence is very frequent, usually committed by someone in the family, father, mother, son, grandfather, etc., or very close, like uncle, father in law, son in law, cousin, friend, or with a bond of affective boyfriend, fiance, partner, ex husband. Domestic aggressions include physical, sexual, and psychological abuse, neglect, and abandonment, among others. Sexual violence is the one that forces a person to have sexual, physical, or verbal contact or to participate in forced sexual relations through intimidation, coercion, blackmail, bribery, manipulation, threat, or other mechanism that nullifies or limits personal will. For example, rape, attempted rape, seduction, indecent assault, or an obscene act. Sexual violence causes physical and psychological disorders, especially when it involves children and adolescents. It's a crime, and like all forms of violence against women, it must be denounced. This chart shows data from state capitals of rape for every 100,000 women, being most prevalent in Midwest region, followed by the North region. We know that not all women report an occurrence of rape, and therefore the actual number of cases must be much higher. Only 19% of elderly Brazilian women do not complain of any kind of disease. The other 81%, the main complaint is hypertension, followed by vision problems, back or spine pain, diabetes, heart disease, among others. The participation of women in high positions in Brazil is small. The legislative sector, only 12% of senators' positions are held of by women. 8% of deputies are women, and very different from men, and less than 12% councillors. In the executive sector, only 14% are governors, and 7%, a little more than 7%, mayors. In the judiciary, they also hold few positions as ministers. Very different. Despite this, there are more women enrolled in the school than men. They have more study time than men, and they attend more higher education institutions than men. Thank you very much for your attention. I hope you enjoy the class.